Senator Kelly.
Thank you, Madam President. Through you, I have a few questions for the proponent of the bill.
Senator Crisco, prepare yourself. Senator Kelly, please proceed, sir.
As you just mentioned, Senator Crisco, the Connecticut Department of Insurance will review any rate increase that happens. Is that applicable also to the products that are going to be sold in the exchange? Through you, Madam President.
Senator Crisco.
Madam President, through you to the good senator, a resounding yes.
Senator Kelly.
Now, as I understand it in the discussions that you've had with in the circle here, the purpose for this active purchasing is to lower cost. Through you, Madam President.
Senator Crisco.
Madam, I'm sorry, I didn't hear the good senator's last few words.
Senator Kelly, would you repeat that, please?
Certainly. One of the primary purposes of the bill is for the exchange to negotiate premiums. Through you, Madam President.
Senator Crisco.
Yes, Madam President, and to follow up on that, basically exchange is to promote affordability and also to conform with the complex requirements of the Affordable Care Act.
Senator Kelly.
Thank you, Madam President. And with regards to affordability, what we're talking about is the rate that's set for the premium. Through you, Madam President.
Senator Crisco.
Madam President, through you to the good senator, yes for each specific plan that will be offered by the exchange.
Senator Kelly.
And what goes into setting that rate? How do insurance companies determine the cost of the rate? Through you, Madam President.
Senator Crisco.
Madam President, through you to the good senator, I assume they have an actuarial department and they determine their rates, and likewise the Department of Insurance has their actuarial experts and which provides the expertise in approving or disapproving rates.
Senator Kelly.
When we look at the products that are going to be sold in the exchange, is there just going to be one policy for everyone that participates, or are there going to be multiple levels of policies? Through you, Madam President.
Senator Crisco.
I believe, to my knowledge, is that there's going to be at least 4 different plans: gold, silver, copper, and some other metallic, name.
Senator Kelly.
Thank you, Madam President. Now, how do those relate to the essential health benefits package? Through you, Madam President.
Senator Crisco.
I believe the exchange is in the process of determining that.
Senator Kelly.
So then today we don't know how the essential benefits package is going to interface and interrelate with the policies in the exchange. Through you, Madam President.
Senator Crisco.
Madam President, I believe through the regulations recently promulgated by the federal government, I think we will know, and each plan will have a different level of benefits. And as the good senator knows, that through HHS ruling last December, there won't be any new mandates, but it'll be up to the exchange and to develop different benefits for each plan.
Senator Kelly.
Thank you, Madam President. But as of today, we do not know the answer. Well, let me restate that. Today, we don't know the answer to that question because the regulations haven't been adopted. Do you know when the regulations will be adopted? Through you, Madam President.
Senator Crisco.
Madam President, the exchange is still working on the development of their plans, and according to the recent regulations, and so at the appropriate time, each plan will have specific benefits.
Senator Kelly.
Do we know the date that the exchange will go, for lack of a better term, live? Through you, Madam President.
Senator Crisco.
When are they going live? When are they going to go live? Madam President, through to the Senator, I greatly appreciate his questions. I know that enrollment starts in October of 2014, and we'll go forward from there.
Senator Kelly.
Are you certain it's October of 2014? Through you, Madam President.
Senator Crisco. I thought you said 13, sir.
Madam President, through you, according to my information, yes.
Is it 2013, this October, or the October following this October, October of 2014?
Senator Crisco.
Madam President, through to the Senator, because of static and the different communications, the Senator is correct. It's 2013.
Senator Kelly.
Okay, so we know that in October of 2013, we're going to have an exchange go live, but we have no idea what or when the regulations will be adopted. Can you explain to me the time frame of the regulatory process? Through you, Madam President.
Senator Crisco.
Madam President, I believe the federal regulations have already been adopted, and if the good senator in the future would like me to get a copy of them for him, I'd gladly get a copy of them for him.
Senator Kelly.
Well, I'd really like to know, before we vote, what that process is. Because as I understand this, if the exchange is going to be up and running come October, wouldn't it be important to have an understanding as to what the essential benefits package is, what the various policies are? You've mentioned 4 metallic policies, and how they interrelate before you sit down to negotiate. To me, you got to know, like if I'm going to buy a car, if I'm looking for a Chevy, I need to know I'm looking for a Chevy. I need to know if I'm looking for a 4-door or a coupe, or has air conditioning or not. It's not, well, we're going to buy a car. So what's the regulatory time frame that we're going to have that essential benefit package in place and understand how it interrelates to the 4 policies that are going to be offered in the exchange? Through you, Madam President.
Senator Crisco.
Madam President, through you to the good senator, if the senator wishes to go online, the exchange's webpage, you can find out that information.
Senator
It is available at the present time.
Senator Kelly.
Could we stand at ease for a moment?
The Senate will stand at ease, sir. Senate will come back to order. Senator Kelly.
Thank you, Madam President. Can Senator Crisco explain to me which is the least expensive of the four policies? Through you, Madam President.
Senator Crisco.
Madam President, I would think the value of each metal will determine, I believe, if gold is the most expensive, diamond is next. Maybe there's a platinum. If there's a copper plan, then I think it will be the copper plan.
Senator Kelly.
What's the difference between the four policies? Through you, Madam President.
Senator Crisco.
Madam President, through you, as Senator Kelly is probably aware, it depends upon the benefits of the plan.
Senator Kelly.
But if I'm a consumer at home trying to understand how this exchange is going to be beneficial for me, could we get an explanation as to like what the copper plan is versus the silver versus the gold versus the platinum? There's got to be a difference other than just price as to what is the distinguishing factors in each one of these four categories. Through you, Madam President.
Senator Crisco.
Madam President, through you to Senator Kelly, I'm sure that he's aware that platinum is the top plan.
Senator Kelly, could you repeat your question to Senator Crisco, please?
Sure, Madam President. What I'm asking is for those viewers at home that are watching this, so that they get a better understanding of what the exchange is all about and how this works, if we could get an explanation as to each of the various policies that are going to be offered and the distinguishing factors between bronze, silver, gold to platinum. Other than cost, why are they different? What distinguishes those policies? Through you, Madam President.
Senator Crisco.
Madam President, through to good Senator, each plan will have a different cost structure. The insured may pay 90% of a particular plan, 70%, and these aren't accurate, 50% or 40%. So that's the base. The plans will all be the same. The cost to the individual will be set by the plan that they want.
Senator Kelly.
Now, if I visit the exchange, what type of information is going to be provided to me? Through you, Madam President.
Senator Kelly, can you repeat that one more time? I'm sorry.
Sure. After October 1st, if I were to visit the exchange, what kind of information am I going to be provided? Through you, Madam President.
Senator Crisco.
Madam President, through you, it would describe the essential benefits and the type of plan and what the cost of each plan is.
Senator Kelly.
And how will that be done? Is it just going to be listed there? Like, is it going to be standardized or not? Through you, Madam President.
Senator Crisco.
I'm sure the exchange would depict it in an understandable and very clear, way, so anybody could understand what each plan offers and what the cost is.
Senator Kelly.
Now, when it looks at costs, it also has a requirement under the bill to publish the costs of licensing, regulatory fees, any other payments, the administrative costs, and monies lost to waste, fraud, and abuse. How is that going to be provided in the exchange? Through you, Madam President.
Madam President, through to the good Senator, it will be in the summary for each plan. In the summaries for each plan.
Senator Kelly.
And will that be something that I'll have to, how easily accessible will that be? Through you, Madam President.
Senator Crisco.
Madam President, through to the good Senator, it's on the website.
Senator Kelly.
Now, the exchange is going to administer for both qualified individuals and qualified employers. How does an individual become qualified? Through you, Madam President.
Senator Crisco.
Madam President, through you to the Senator, the whole purpose of the plan is to provide insurance. So if they don't have insurance, they could be qualified.
Senator Kelly.
So then anybody without insurance is a qualified individual? Through you, Madam President.
Madam President, through you to the Senator, yes.
Senator Kelly.
Okay, so if the exchange is only there for qualified individuals, what if I have insurance, but I'm looking for a different coverage or policy? I can't participate in the exchange? Through you, Madam President.
Senator Crisco.
Madam President, through you, yes, you can participate.
Senator Kelly.
So then individuals with insurance are also qualified individuals? Through you, Madam President.
Senator Crisco.
Madam President, through you to the Senator, yes.
Senator Kelly.
So why are we qualifying individuals? It says here that the exchange is administered for both qualified individuals. I was told it's for people that don't. Qualified individual is somebody without insurance. It's also somebody with insurance. What's a qualified individual? Through you, Madam President.
Senator Crisco.
Madam President, obviously, through to the Senator, if you have a plan and you qualify for an exchange plan, then you'll have to drop your existing plan and participate in the exchange plan.
Senator Kelly.
So if I understand what you just said, it's somebody who participates in a qualified plan in the exchange? Through you, Madam President.
Senator Crisco.
Yes, Madam President, for the individual, through you, I'm sorry, to the good Senator, somebody who would qualify can participate.
Senator Kelly.
Now, as far as a qualified employer, is that the same answer except applicable to employers? Through you, Madam President.
Senator Crisco.
Madam President, through to the good Senator, no, there are different guidelines.
Senator Kelly.
So what's a qualified employer? Through you, Madam President.
Senator Crisco.
Madam President, qualified employers, those qualifications that are set up by the exchange.
Senator Kelly.
Madam President, may I add just one thing? Basically, it's a small employer. How you define a small employer? There's different. There's a specific definition in the regulations to define a small employer.
Senator Kelly.
So the qualified employer is a small employer. I'm not sure. Could Senator Crisco repeat the answer?
Senator Crisco.
Madam President, through to the good Senator, yes. It's a small employer.
Senator Kelly.
Okay, so it's just, now is it all small employers, and how do we define small? Through you, Madam President.
Senator Crisco.
Madam President, through to the good Senator, small employer is defined as 1 to 50 employees.
Senator Kelly.
So
And Madam President, may I finish through?
I'm sorry, sir.
Well, thank you, to the extent. And up in 2017, I believe it's going to increase to 100.
Thank you. Senator Kelly.
So if I'm an employer under 50, then I can participate as a qualified employer in the exchange. If I have 51 employees, can I participate in the exchange? Through you, Madam President.
Senator Crisco.
Madam President, according to my knowledge, it's up to 50.
Senator Kelly.
So over 50, if I understand that correctly, then an employer over 50 cannot be in the exchange. Through you, Madam President.
Senator Crisco.
Madam President, through you to the good Senator, but then remember by 2017 the number expands to 100. Whether an employer has 51, I believe maybe the exchange could, maybe there's some requirements that I'm not aware of that might make an exception. Depends upon when a person is applying, when the employee was employed by the company. I think the good senator will understand that sometimes there are moving parts and there has to be some adjustments.
Senator Kelly.
Thank you, Madam President. But if I understand it correctly, whether it's 50 or 100, there is, well, let me, before I go into that question, what about self-funded plans? Are they in the exchange through you, Madam President?
Senator Crisco.
Madam President, through you to the good senator, no.
Senator Kelly.
Okay, so self-funded plans, which are basically your large employers, are not in the exchange. Small employers, currently up to 50, 2017 at 100, will be able to be in the exchange. But what about the middle company, that company that has 150 employees? What about that employer? Does that employer, where do they go? Through you, Madam President.
Senator Crisco.
Madam President, at the present time, they don't go anywhere. But I assume, I'm sure that with the leadership of the exchange, that if there seems to be a need, then that would have to be explored.
Senator Kelly.
Now, with regards to informing individuals, I also understand that they're going to be informing people that come to the website about public assistance programs like Medicaid, CHIP. Are there any other programs that they will be informed about? Through you, Madam President.
Senator Crisco.
Madam President, through you, I believe it's Medicaid, CHIP, and the qualified health care plans in the exchange.
Senator Kelly.
Are we going to take any initiative to inform them of federal benefits, not necessarily state or local? Through you, Madam President.
Senator Crisco.
Madam President, we have, through the good senator, different agencies with different responsibilities. The exchange will not be doing that, but I'm sure that DSS will take that responsibility.
Senator Kelly.
Okay. Now, one of the options here was to offer the enrollees and small employers the option of having the exchange collect and administer premiums, including through allocation of premiums among various insurers and qualified health plans chosen by the individual employers. Why is that a benefit? Through you, Madam President.
Senator Crisco.
Madam President, because it would add cost to the small business if they were to do all the processing. So the exchange would pick up that cost.
Senator Kelly.
Do we know the cost of the policies in the exchange now? Through you, Madam President.
Senator Crisco.
Madam President, through you, some of the rates have been filed, but not all the rates, to the good senator.
Senator Kelly.
How many carriers are in the exchange right now? Through you, Madam President.
Senator Crisco.
Madam President, through to the senator, 3 plans have been submitted, and they have to be approved.
Senator Kelly.
So we have 3 plans that have not been approved.
Madam President, through you to the good senator, not yet. They haven't been disproved. They're still in the process of being, analyzed.
Senator Kelly.
So we have 3 plans that have not been approved yet. And how many insurance carriers offering health insurance are there in the state of Connecticut? Through you, Madam President.
Senator Crisco.
Madam President, through you to the good senator, there are 5 large companies, and I would assume many more smaller companies.
Senator Kelly.
When we say many more, is it like 1 or 2, or is it more like 10 or 20? What's the number? Through you, Madam President.
Senator Crisco.
Madam President, through to the good senator, yes, he's correct.
Senator Kelly.
I don't know what to do with that.
Well, Madam President, to the Senator, again, I know how diligent he is. He could go on the insurance department's website and get a listing of all the insurance companies. But to ask me the specific number at this present time, I don't think is very, very practical.
Senator Kelly.
Thank you, Madam President. Well, what I'm drilling down on is that I read sections lines 62 through 65 and wanted to know why that was in the bill. And what I was told is that this is there and it's necessary because this is going to lower costs. But the problem that I'm having with this is that costs, to a large extent, is determined by rate, and those rates haven't been approved. So we don't even know what they're going to be, whether they're going to be bad or good, or what the, expensive or inexpensive. Coupled with the whole notion of the exchange and the Affordable Care Act is based on pooling. It's under the notion that if you get more people in, it creates competition. But as we've heard, we only have 3 carriers in. There could be as many as 25 other carriers. So we have a small fraction of the insurance market there. So we don't have a lot of pooling going on. So given the fact that we don't know what the cost of these are, and the fact that we don't have a large pool, it would seem to me that this is a little bit premature. Madam President, the clerk has an amendment, LCO number 7415.
Mr. Clerk.
LCO number 7415, Senate A, offered by Senator Kelly.
Madam President, I move adoption by roll call and seek leave to summarize.
Okay. Senator, it's Senate C that has been called, and the motion is on adoption. Will you remark, and a roll call vote will be had?
Thank you, Madam President. What this amendment will do is this will eliminate the ability of the exchange to collect premiums on behalf of the employees and the employers. I think it's a good amendment. It makes the bill a better bill, and I would urge its adoption.
Will you remark? Senator Boucher.
Thank you, Madam President, and I thank the good senator for his amendment. A question through you, Madam President.
To the
proponent of the amendment.
Please proceed, sir. Ma'am.
Yeah, yes.
Sorry, Senator Kelly.
Through you, Madam President, this bill is putting back the responsibility of paying their insurance premium on the employee versus having the exchange then become, what I understand, to become the insurance company versus a governmental exchange. Through you, Madam President.
Senator Kelly.
Thank you, Madam President. Although I didn't catch the whole question, I think what Senator Boucher is going at is, why would this be a good idea? And I think the reason it would be a good idea is that the exchange, as it's in its formative stages, I think everybody wants the exchange to succeed. I don't think there's any dispute on having more affordable health care that people can utilize. But the issue becomes, particularly with regards to the exchange, is to make sure that that marketplace gets off the ground successfully. And by adding this duty to all the other duties that the exchange has to undertake, and there are many, and there are some concerns voiced by the exchange with regards to this, that taking this off their plate is going to be one step to enabling the exchange to succeed. Through you, Madam President.
Senator Boucher.
Thank you very much, Madam President, for the good senator's answer to the question. It reminds me very much of what has happened structurally to the whole healthcare industry in the last couple of decades when, in fact, doctors' offices has assumed more and more of the administrative responsibility for insurance companies, for hospitals, healthcare concerns, when they have had to process claims. There was a time, actually, when employees went to their employer to put in their claim for a healthcare procedure, and it appears that this process with the exchanges is doing the same, and that is putting a lot of the administrative procedures onto, as was just stated, a fledgling new entity of what many are reporting to be a very confusing, lack of transparency process with a lot of unanswered questions still, and those questions I will save for the underlying bill and for the proponent of the actual bill itself, and believe that this is a friendly amendment, makes good sense, and should be adopted. Thank you, Madam President.
Thank you. Will you remark, Senator Crisco?
Thank you, Madam President. Madam President, I am somewhat shocked that the other side of the aisle would add costs to small businesses, and that's exactly what this amendment does. So I would ask that to be rejected.
Will you remark further? Will you remark further? If not, Mr. Clerk, will you call for a roll call vote, and the machine will be open on Senate C.
Immediate roll call has been ordered in the Senate. Senators, please return to the chamber. Immediate roll call on Senate Amendment Schedule C. Senators, please return to the chamber.
Mr. Clerk, can you recall the roll call vote, please?
Immediate roll call on Senate C. Ordered in the Senate. Senators, return to the chamber. Immediate roll call in the Senate.
If all members have voted, the machine will be closed. Mr. Clerk, will you please call the tally?
Senate Amendment Schedule C for Senate Bill 596. Total number voting 33. Those voting yea 11. Those voting nay 22. Absent not voting 3.
Senate C has failed. At this point, I'd ask if you have any points of personal privilege. Senator Guillermo.
Thank you, Madam President. I do have a point of personal privilege.
Please proceed, sir.
Thank you. I would like to introduce to the circle the Woodstock Academy Class L Boys Basketball Championship team. Just so you know, I'm so sure some of you know, we're from the quiet corner. And as Senator Williams knows well, we have long, cold winters, right? We have country roads to travel on. So basketball gets us through the winter. And we had a good winter. We had the UConn men's basketball team exceeding all expectations the way they played. The women's basketball team, I don't think there were too many people who would think they'd be the national champion. And then you had these young men right in front of you right here. And they are from such towns, basketball hotbeds: Brooklyn, Canterbury, Eastford, Pomfret, Union, and Woodstock. And I guess the starting team, I talked to the coach right before, they played in the championship game Trinity Catholic, who had starters from New York. These are from New York City, by the way. New York City, and Stanford. And these guys are the country boys. So anyway, they pulled off a tremendous upset, I believe, anyway. And I know one of the early plays, I followed them in the newspaper because I was excited by what they were doing. And one of the early plays was a court-length pass to Ian Converse, and he flushed it. And I think it kind of set the tone for the rest of the afternoon, surprised the opposition, certainly. So anyway, I think it's pretty remarkable what you can do when you're a band of brothers. You know, when you work together and you're unselfish and nobody cares who scored the basket. That's what's so wonderful about sports. That's what I enjoy. I mean, our outcomes here are a little more predictable, Madam President. But the outcomes in sports are not very predictable. That's why they play the games. And that's what makes it so much fun. So I'd just like to read the citation that was introduced by Representative Mike Alberts, by Representative Brian Sear, by Senator Donald Williams, and by me, to the Woodstock Academy boys basketball team winning the 2013 Class L state championship. Your exceptional athleticism, teamwork, and selflessness reflect on Woodstock Academy and its sending communities of Brooklyn, Canterbury, Eastford, Pomfret, Union, and Woodstock. We join with the Woodstock Academy community to congratulate its players, coaches, supporting staff, families, and fans on a historic and inspirational achievement. And I know that the place was packed with people from Woodstock at the final game. From one of our aides here is a Woodstock Academy graduate. He went to the game, Andrew Larson. He said the place was packed. I guess just about the entire community of Woodstock was there. So it was great. So I'd like to just take a minute just to introduce the boys, and then we have, if you guys would step by, I understand there's one or two missing. One of the guys that at track meet, but Jake Almquist, he's the one. Okay. How about that? Ian Converse, step up, just step forward. That's it. Okay. That was a big step. All right. Henry Cameron, Tristan Welch, Will Boucher, Kyle Duthorn, I hope I'm not butchering too many of their names, Kent Comanzi, the manager, Zachary Lofhead, Chris Lowry, John McGinn, Trent Peters, Adam Converse, Oliver Simon, Gardner Sullivan. I got it backwards. We do that a lot in this chamber.
Right.
And I also like to introduce Mrs. Holly Singleton, Holly's associate headmaster, and a new athletic director, Aaron Patterson. Also have coaches Greg Smith, who's here today, and Dave McGee. So if we would give the traditional welcome from the State Senate to these band of brothers, I'd appreciate it. Thank you.
Congratulations. The quiet corner is no longer quiet because of you. So welcome and thank you very much and congratulations. And I can't wait till tell the governor that the quiet corner beats somebody from Stanford. Thank you all very, very much. Good luck. We'll return to business right now. Maybe you won't. Senator Kelly. Why do you rise, sir? Senator Kelly.
Thank you, Madam President. Talking still on the bill.
On the bill, sir.
I do rise because one of the comments at the end was that, allowing the exchange to collect the premiums would be a reduced cost to small business. And I know in my district, and I just recently met with the Greater Valley Chamber of Commerce about a week to 10 days ago, many of the employers were talking exactly about the Affordable Care Act and the exchange, and they wanted to know what's the exchange going to look like, what's going to happen. And the problem is we don't know right now exactly what's going to happen, because right now, before we deal with this bill, we don't know whether it's going to have active purchasing or not. But yet they're trying to plan for the future, and they're being held back. And I know I've talked over the past few years that I've been a state senator with many small businesses and many individuals that are looking for health care, affordable care. And the issue that becomes prevalent is that cost does continue to go up. But there is a relationship between the premium, the rate, and what we mandate. So as we mandate more benefit, the cost goes up. As the cost goes up, many times that goes beyond the capability of the individual or the employer. And so we have that issue, that negotiation isn't the only factor that goes into reducing costs, that there are other factors. We can look at issues of fraud and program abuse. You can look at various ways to let the industry work to provide cheaper insurance and plan design, allow innovation to occur in the marketplace, provide high-quality providers with higher rates rather than capping all rates across the board. We could strengthen the insurance department rate review, which we've done, allowing individuals the opportunity to public hearing and to voice their concerns on increases. We could better market federal small business tax credits so that businesses can use those to purchase insurance. Strengthen primary care and make it more efficient. There are ways to bring health care costs down. It's not all done just based on the insurance product. The other question that always comes to mind when we're getting in this area is not just all about the insurance, but where, once I do have insurance, am I going to get the quality care? So while we're looking at quality insurance, we also have to keep our eye focused on quality care. And what good is a great insurance product if I can't go to my local hospital because it no longer exists? Or because they don't offer the services that they once did, because the costs that we're levying against the hospital industry is making them retreat from the healthcare field, and looking more and more at what their core functions are rather than offering specialized services to people in need in the areas that they serve. So when we talk about affordable care, it's not just talking about getting great insurance products. That's a component. Don't get me wrong. But part of it isn't just a good insurance policy. It's also making sure that when I take that insurance policy, there is A, provider there, and B, that provider is capable of providing the care. And we need to look at the whole picture, not just a part of it. Now, the insurance exchange, October 1st is just a few months away. In a couple weeks, less than that I guess, we'll be done here. We'll have June, and people will be off for July, August, September, and then in October, the exchange takes off. And one of the concerns that was raised back in November when Access Health Connecticut was looking at this issue, and these are the individuals that work on the exchange. These are the professionals, the individuals that we entrust with the governance of the exchange. When they had to weigh in on this and discuss it in November, here's some of the comments that were made. Peter Van Loon, who's the Chief Operating Officer for Access Health, stated, "We feel that active purchasing is a valid potential tool, but the idea of mandating it in the short term," and this is November, it's not May, "may not be something that we can do based either on the laws or the information that we are going to be able to have." So he didn't think at this time it was the proper thing to do. Ben Barnes, who's the Secretary of the Office of Policy and Management, stated, "I'm comfortable with this," meaning to not do active purchasing now. "I'm comfortable with this only because it leaves the issue of negotiation as something to be evaluated in the future, because I really don't think we know enough now to make wise decisions about it." Now, this is somebody talking about this issue in November. Once again, not the end of May. The exchange CEO, Kevin Cunahan, warned that negotiation rates could interfere with the new market's viability. The viability of the exchange could be compromised. He stated, "Price negotiation in the startup period of the Affordable Care Act is impractical and risks diluting a key competitive advantage of the exchange. We do not know the number of enrollees in the exchange, what products they will buy, their health status and utilization level, their geographic or demographic mix, the stability of the enrollee population, or other details required to be substantive negotiation with an insurance company." What everybody involved with the exchange was warning, that moving in this direction too fast, too soon, without the proper information, may actually threaten the viability of the exchange itself. Now, there is some information out there that will demonstrate that Massachusetts may have experienced lower premiums. But where they used active purchasing was for their subsidized population, where the information was known. They knew who the enrollees were. They knew what their utilization was. They had the proper information before them so that they could make those wise decisions in a negotiation. We're not limiting our active purchasing to those individuals that are just subsidized. We are going to go much beyond that. We're going to open it up to everyone, populations that we do not have information on. I believe what we need to do is to listen to the people that we have appointed and to hear what they have to say about going forward. Once again, Kevin Counihan, at the committee level, this was his testimony. The prospect of Access Health negotiating rates with participating health plans is seemingly logical. Who wouldn't want to negotiate price for any product or consumer good if it might result in a better price or better value? And I think there is a lot of common sense in that. The challenge is that price negotiation in the startup period of the Affordable Care Act is impractical and risks diluting the key competitive advantage of the exchange. We do not know the number of enrollees, as I just said, in all the other information. Quote, in other words, such negotiation is analogous to negotiating the purchase of a car without knowing the desired year, make, model, accessories, or condition. Further, the idea of prospective rates negotiations without factor data will likely result in fewer carriers participating in the exchange, both limiting consumer choice and reducing marketplace competition, which is both a core concept of exchanges and which will likely result in higher prices. As the exchange enrolls members, it will begin to collect the needed data to support an evidence-based approach to any potential negotiation. Basically saying that if we wait, give the exchange time to get up, get moving, collect information, then that information becomes a powerful tool in negotiating down the road. But at this point, we don't have that luxury. What he finally said was that I returned yesterday from a meeting with the CEOs of 17 other states implementing state-based insurance exchanges. I polled each of the 17 states to determine which states were prospectively negotiating rates with carriers, including Massachusetts and California. The result was not one of the 17 states were negotiating rates for the reasons I've outlined. At this point, based on what the professionals involved with Access Health, the exchange, we don't have enough time to adequately prepare ourselves for active purchasing negotiation. We need time to get more data so that when we utilize that tool is an effective tool and not one that may dilute the market. Mr. President, or Madam President, excuse me, the clerk has an amendment, LCO 5878. Will the clerk please call the amendment?
Mr. Clerk.
LCO number 5878, Senate D, offered by Senator Kelly.
Senator Kelly.
Thank you, Madam President. I move adoption by roll call and seek leave to summarize.
Motion is on adoption. There will be a roll call, and please proceed, sir.
Thank you, Madam President. What this amendment does is it would put off the active purchasing idea and enable the exchange to study the feasibility of negotiating premiums. And the study would begin 1 year after the exchange operation. What it's going to do is it's going to take the wisdom of the CEO and the individuals that I mentioned, not put too many administrative burdens on the exchange right now, give them the opportunity to evaluate, study, and come back so that we can look at an exchange that has viability, has the necessary information, and then can actually negotiate in a manner that would be more effective. I would urge its adoption. Thank you, Madam President.
Will you remark? Senator Crisco?
Thank you, Madam President. Madam President, I rise in opposition to the amendment. Some of the information quoted by the good senator was over 5 months ago. Much has transpired since then, and Mr. Cunahan has taken the position now that it's time for the exchange to negotiate rates by using experts in actuarial study. So I would ask that the Circle reject the amendment.
Will you remark further? Senator McLaughlin.
Thank you, Madam President. I stand to support the amendment, and I have a couple of questions to the proponent of the amendment.
Please proceed, sir. Senator Kelly.
Thank you, Madam President. Senator Kelly, thank you for bringing forth this amendment. This was a concern of mine earlier in the discussion here today about this proposal. I did hear something as I was in the other room on the phone. You said something about 17 other states had rejected the idea of the process that is proposed before us today, and I wonder if you might elaborate a bit on that information.
Senator Kelly.
Thank you, Madam President. This was testimony that was delivered at the Insurance Committee level back January 31st by the CEO of the exchange, Kevin Cunahan. And what he said was, finally, I returned yesterday from a meeting with the CEOs of 17 other states implementing state-based insurance exchanges. I polled each of the 17 states to determine which states were prospectively negotiating rates with carriers, including Massachusetts and Connecticut and California. The result was not one of the 17 states were negotiating rates for the reasons I outlined. And that was basically that, the reasons he outlined was that we do not know the number of enrollees in the exchange, what products they will buy, their health status and utilization level, their geographic or demographic mix, the stability of the enrollee population, or other details required to have a substantive negotiation with an insurance company. Now, these were the last known published reports from Mr. Cunahan. We've done a Google search of Mr. Cunahan to see if he's made any other comments, as we've heard that he's changed his position. But he hasn't done that publicly that we've been able to find through a Google search.
Senator McLaughlin.
Thank you, Madam President. And thank you for that information, Senator Kelly. So it does, my initial reaction to this bill after listening to the earlier testimony was that we should take pause and give a bit more time to allow the health insurance exchange building process to continue before we put up further barriers for health insurance companies to enter the health insurance exchange. And so I gather that you share that concern with me, that the CEO of the exchange expressed that same concern. Would you agree that that's why we should postpone? Through you, Madam President.
Senator Kelly.
Thank you, Madam President. Yes, that's exactly the way I would view this, is that there's those individuals. And when we first created the exchange, we created a board of governors, if you will, that would be responsible for the governance, the administration, the management of the exchange. Professionals, if you will. And now those individuals came back and said, we're in the process of getting the exchange going. It's slated to be effective October 1st. We've got a lot of work to do to get that exchange working, but to bite off this might be a little bit too much. It might go a little bit too far. It may be beyond our pale. And so prudence would be better exercised in order to maintain and give the exchange not only viability and stability, but the greatest potential, because information is power. And if given the opportunity to enable people to get into the exchange and get the information that I talked about, utilization, demographic, you then can use that in your negotiations with the insurance carriers going forward and have a much stronger tool in the toolbox. What this may do, and what the concern is that we're going to limit that. As we've heard, we've only had 3 carriers say that they were going to get into this exchange. If you have a small negotiation pool, you're not going to be able to negotiate as good a product as if you had maybe 10 or 15 participants. So that's the concern that the professionals in the exchange voice, and I haven't seen anything publicly to the contrary from them. So, yes, you're right. Through you, Madam President.
Senator McLaughlin.
Thank you, Madam President. And through you, Madam President, to Senator Kelly, is it your understanding then that the national assessment, if you will, of the health insurance exchanges process is that if it is a active process where all insurance companies who are duly qualified are encouraged to join the exchange, that is a more productive and in the long run potentially less expensive opportunity and health insurance costs for residents as opposed to a very restrictive process that is being proposed in the underlying bill. Through you, Madam President.
Senator Kelly.
Thank you, Madam President. Yes, I think it depends upon one's perspective on whether you want to go in the area of active purchasing or open marketplace, and where you believe that there's better benefit. Do you believe that, for instance, an exchange has better success with negotiating insurance companies and using the leverage of the participants to negotiate better? Or do you believe in an open marketplace where you're going to allow basically the market to come in and to put their products out there and let the market innovate in order to achieve efficiencies and cost savings? It's, where do you believe in? Do you believe in government and administration, or do you believe in open market and capitalism? Through you, Madam President.
Senator McLaughlin.
Thank you, Madam President. Thank you, Senator Kelly, for your proposal to study this further. I think that's an appropriate action to take at this point. Given what we've heard is that so many other states looked at the opportunity that is being presented to Connecticut by way of the underlying bill to be very restrictive and passed on that idea and felt that the open market is the right way to go. So if so many other states were seeing that as the appropriate way to take care of this for now, I think that your idea of studying it further is appropriate, and I would encourage members of the circle to support this amendment. Thank you, Madam President.
Thank you. Will you remark?
And just in response,
Kelly?
Senator McLaughlin, you're right. And one of the issues is to look at, before we say that active purchasing doesn't work, is at least take the step back. Because we got to, let's put this in context. This is the Affordable Care Act. It's a new frontier, if you will. And with the exchange, which is a significant component to the Affordable Care Act, that before we go and commit ourselves to one avenue or the other, at least let's make a reasoned and a rational choice based on information. Let the exchange perform. Let's get that necessary information. So then we can decide, okay, will the active purchasing succeed, or would an open marketplace be better? And if we did decide to go with the active purchasing, well, then you have information there. It's not going to make your negotiation tool less beneficial. It's going to strengthen it, because now you have more information upon which to negotiate with. You'll know what you're buying. And wouldn't we want, when we negotiate, as much information as possible? I mean, I just don't think that when you go and sit down in any type of negotiation on any contract or any good or service that you buy, that it's better to go in blind, to not do any research. I mean, how many people, when you go and buy a car, pick up Consumer Reports? I know when I do it, I don't read Consumer Reports every month. But when I'm going to buy a car, guess what I do? I go out, I pick up the latest copy of Consumer Reports, I start to look down, see what cars are for, what their ratings are, see what's a good car, what's not a good car, what's reliable, what their mileage is. And then once I get all that information, then I go out to the dealer and I test drive the cars. Figure, do I like this? Do I not like this? And I ask each dealer, what do you have? What can I afford? And then based on that information from the various dealerships, you then start to narrow down and you get a better deal when you know what you're buying, what the cost is, and what they're willing to sell it to you for. And I just can't understand why, when we're going to look at something as important as health care to the families of Connecticut, we don't want to take that time, that type of activity and study, research, to give our exchange the most power it could possibly have. We're asking our families to go to the car dealership with no homework, and we're going to drive a good deal. And this is where I think sometimes people back home on the streets find a disconnect, because that's the way the people of Connecticut negotiate. But when we're here, we don't want to do it that way. For what reason, I don't know. But I think that's a good thing. Thank you.
Will you remark, Senator Boucher?
Thank you very much, Madam President. Madam President, I rise to support this very important amendment, and I applaud the good senator's passion on this issue. When some may find themselves not as tuned in as what's going on, it actually has become a debate about the national health care bill that was passed, and in fact was also brought to the federal Supreme Court level, which the decision ended up being that, in fact, the Obamacare plan was constitutional, but that states had the full right to engage in that plan or not to. And Connecticut being one of the few states that actually moved forward with it, I understand, and I could be corrected, and I hope that I am by those that are very knowledgeable about this on the Insurance Committee or the Health Care Committee, that 33 states may have opted out. So certainly Connecticut is an interesting place for individuals to look at in this process. I believe that some of the outrage that may be expressed by my good colleague may be that there's decidedly a sense of feeling that there is less interest in the free market, the open system, the competitive market in this General Assembly, that there might be a desire to have the government side make the plans and carry out the plans and provide that service to the public or even to our business sector. The amendment that is being proposed is a good one because it really expresses the concern out there that was just reported just this last Friday in the Connecticut Mirror that talked about an interview with the CEO of Healthy Connecticut, Kenneth Lamine, that talked about, who is going to be a new nonprofit insurer, that says there are a lot of moving parts and everybody has all of that to struggle with. It's the first time in a long, long time that the rate process has been so dramatically changed. And in fact, they go on to talk about the various actual monthly premiums that are being put out there for individuals in small groups. And then the confusion about has been expressed this afternoon of what is a qualified employer, what's not a qualified employer. Connecticut's Vice President for Actuarial Services, in addition in responding to this issue in the proposals, pointed to the uncertainty surrounding the Affordable Care Act, the federally mandated health care reform law, and talks about the fact that the federal and state regulatory environment since the passage of this has been unclear, confusing, and fluid, noting that federal agencies have and are continuing to publish thousands of pages of regulations, thousands. Many of these regulations are complex, vague, incomplete, and even contradictory. It's like we're flying blind here from the very individuals that are charged to analyze and give us what we should be doing and setting the standards with the kind of data that's required, and why this particular amendment that Senator Kelly is proposing is so incredibly important for the integrity of this process. The article goes on to say that an estimated 80,000 to 100,000 currently uninsured people are expected to buy coverage through the state's exchange, which is called Access Health Connecticut. And among the questions insurers must address is how much of that customer base will be people in poor health who haven't been able to afford coverage in the past, and who will likely use a lot of costly medical services. How many of the newly insured customers will require significant medical services to address health problems that lingered while they went without insurance? How many of the customers will be healthy young people who have previously never been motivated to buy or even afford coverage? People who probably wouldn't cost much to cover. That's really important when you're setting a rate. You need to know all of the particulars of that to be able to properly put out a price that will cover this without it going into deficit, without putting the entire program at risk. They go on to state that on top of that, the health reform law changes that benefits plans must include requiring all plans to cover essential health benefits and pay at least 60% of the customer's medical cost. Currently, in the system that everybody is used to, many plans cover far less than that. Additionally, the law restricts some of the tools insurers have been used to set prices in the past. It limits how many premiums can vary based on a person's age, prohibits insurers from charging different rates to men and women. Many of us probably like that, but as women, we probably would be charged more, wouldn't you think? We usually used to fare fairly well given our healthy lifestyle and longevity. And it won't let the companies charge people in poor health more, which again is a typical part of what a cost structure would entail. Additional unknowns, it's a new market, so it doesn't have any claims history to rely upon in setting rates. And based on proposals, on projections prepared by the actual firm Milliman. Kinetic Care Benefits is also a new company. So there's a lot of beginners here in this journey to really put this in place. And wouldn't Connecticut benefit from being successful? One good way to be successful is not put the cart before the horse and make all your mistakes first and then have to come back and legislate over again. That is a costly process, very costly, and it would be very costly for the state. Additionally, the cost needs to consider those earning below 400% of the federal poverty level that will be eligible for federal subsidies in the form of income tax credits to buy their coverage through the exchange. Through you, Madam President, I wonder if I could ask the proponent of this amendment, is there a disclosure of the personal information online, as some have warned, through this process for those that receive subsidies? Through you, Madam President.
Senator Kelly.
Through you, Madam President, could Senator Boucher repeat the question?
Senator Boucher?
Yes, Madam President. Madam President, some have warned or are very concerned about the disclosure of their personal information. Should they be getting some form of subsidy, federal subsidies in the form of income tax credits when they are participating in these exchanges, this program, and the concern about this disclosure online of all their personal data? Through you, Madam President. And through you, Madam President, would this be a part of the study that is being proposed?
Senator Kelly.
Thank you, Madam President. And I believe Senator Boucher is referring to the financial information that would be part of the necessary disclosures in order to participate through or in a subsidy. Through you, Madam President, is that correct?
Senator Boucher.
Madam President, through you, yes, exactly. That is what I'm referring to.
Senator Kelly.
I believe what we would see in the information that we're looking for in the study of the feasibility isn't so much the income data that's necessary in, for lack of a better term, a means-tested subsidy program. What we would be looking for is more the demographic, the age, the utilization, how many enrollees are they, what age brackets, what's their history been, what those types of things that an insurance company is going to look at when they try to negotiate a price for this exchange as to who's participating and what type of services would they be required to provide over the contract that's been negotiated. Through you, Madam President.
Yes, thank you,
Senator
Madam.
Boucher.
Thank you, Madam President. I appreciate that clarification, though not financial information, but personal information on an individual's health. I think that would be very important for this study to investigate, given that so much of our personal information, our health information, is online and oftentimes not disclosed. In fact, it happened to me just on our own health care plan here at the state when I was mistakenly sent a notice that I had a very serious health care diagnosis that really belonged to someone else, and because our names were so similar in the vast database, going to even different doctors and different practices in the state, I was called, and the individual with the serious health care diagnosis was not called, and it took quite a while for me to straighten it out, pointing to the fact that this information on your own personal health care is wide open and certainly open for errors to be made in the system. So I appreciate that that's being done. I also have a question about the price being fixed on this as a part of the study, through you, Madam President. To the good proponent of the amendment, the bill states that it requires the Connecticut Health Insurance Exchange to negotiate premiums on health care carriers and offering or seeking to offer qualified plans through this exchange. And by law, these plans must offer specific benefits at 2 or more coverage levels. And it appears, according to the OLR report, that if a participating insurer offers these plans outside of the exchange, it would be required to charge the negotiated premiums for those plans as well. So I'm hoping through you, if the proponent of the amendment intends for this to be studied by this, because for me it appears to be a form of price fixing, which is, I hope, not the role of our state government. Through you, Madam President.
Senator Kelly.
Through you, Madam President, based on the information that you cited, yes, I would agree with that assessment. Through you, Madam President.
Senator Boucher.
Thank you, Madam President. Again, another good reason why we should proceed cautiously and go the route of this study before it's actually put in place. Another concern I hope that the study would entertain, because this has been brought to us in the form of maybe some other bills on our health care plan, through you, Madam President, there is a concern that embedded in some legislation here at the Capitol that there might be a penalty assessed of $10,000 to small businesses that currently employ someone that may choose to engage in a plan outside of that business, and those that would obtain a subsidy for that outside plan that might choose or been involved in another outside plan, but that business would be assessed a penalty if they didn't offer their own plan to that employee. I think the $10,000 was floated as a penalty. Through you, Madam President.
Senator Kelly.
Are you asking me if $10,000 is the penalty? Through you, Madam President.
Senator Boucher.
Madam President, I don't know whether it's in place yet, but it's my understanding that there are some bills floating around in our General Assembly that would place that penalty on a business should they succeed here, and would that be something that this study would analyze? Through you, Madam President.
Senator Kelly.
I think as this amendment is drafted, we're looking at information that the exchange would have with participants. Okay, you do raise a good point that there is a penalty on employers if they put somebody into the exchange, which I think can be, one of the unintended consequences if a company is going to look at its bottom line and decide, well, it's less for us to buy insurance or to absorb the penalty than it is to buy the insurance ourselves and force their employees into the exchange. But that is a penalty. It is there. But this bill would look more towards the participants in the exchange so that the exchange would be able to get the necessary information as to who the enrollees are, their utilization rates, etc., so that they would be in a better negotiation position going forward. Through you, Madam President.
Senator Boucher.
Thank you, Madam President. I really appreciate the answers by the proponent of the amendment. It sounds to me like he has a very deep understanding of all the issues surrounding this, how it would affect our current small business owners who are already feeling besieged by so many other things that this would add another layer of cost already. And certainly the problem would be that of uncertainty in their business model going forward and how to anticipate what costs to build in to when they're charged for a service or a product, making it, again, difficult for those to stay in the state of Connecticut and conduct their business here. I'm particularly interested that this study would cover the fact that a qualified health care plan, whether offered through the exchange or outside of it, or directly by the carrier or through an insurance producer, would have to set the same premium rate. And if I could be assured through you, Madam President, that the proponent of this amendment fully intends that this study would include that aspect of this particular proposal for analysis as how that could impact our business sector and the success of the program in general. Through you, Madam President.
Senator Kelly.
Are you asking, I just want to restate the question, make sure I understand it. Are you asking whether this study will not only deal with the exchange, but also because the exchange will have influence on the rates outside of the exchange, that you're going to be studying that market-wide also? Through you, Madam President.
Senator Boucher.
Thank you, Madam President. The proponent of the amendment understood it very correctly. That's exactly was my inquiry, and I thank him for understanding the question. Thank you.
Senator Kelly.
The answer is that it's going to look at and evaluate the feasibility of negotiating premiums with health carriers offering or seeking to offer health plans inside the exchange. So we're going to look at the information within the exchange. Obviously, if the exchange is successful and has the necessary information to negotiate, then the marketplace premiums would go down. But this is designed just for the enrollees within the exchange.
Senator Boucher.
Thank you, Madam President. I appreciate the clarification. It appears that the amendment is dealing strictly with those enrollees and businesses within the exchange. However, most of what I've been reading that was of great concern as well is the impact of those choosing to be outside of the exchange, and yet we are regulating them as well by forcing them. In my view, that's a form of price fixing, to also charge the same outside of the exchange, even when commonly used actuarial indicators may point to a need for differentiation in price. Thank you very much, Madam President. That concludes my remarks on this, and I do stand in strong support of a very reasonable proposal for us this afternoon.
Senator Kane.
Thank you, Madam President. Through you, I have a couple questions to the proponent of the amendment.
Prepare yourself, Senator Kelly. Please proceed, sir.
Thank you, Madam President. I have been listening to the debate, especially what took place on the underlying bill between yourself and Senator Crisco, and just want to, if you could, take me back a couple minutes here so I can understand the effectiveness of your amendment. The underlying bill, if it were to pass, would take place upon passage through you, Madam President?
Senator Kelly.
Yes, through you, Madam President.
Senator Kane.
Thank you, Madam President. I guess my question in regard to that is the amendment talks about a study, if you will, a task force and a report talking about the findings of the evaluations of the report and coming back no later than January 1st, 2016. So my question then would be, earlier you mentioned, well, you wouldn't buy a car unless you read up on it. So my question would be that what would this study or this report do in relation to the exchange that is currently set up through you?
Senator Kelly?
Thank you, Madam President. The way the underlying bill is structured, it's going to enable the exchange to it's going to allow the exchange to negotiate premiums. And the concern was that when we first went to this exchange, we put in place individuals to govern it. And we entrusted this exchange with individuals that understood insurance and the purpose of the exchange and gave this endeavor to them to implement. Now, back in November, that body met. They had a meeting. And at the meeting in November, they said, the CEO, basically, knowing we've got to get the exchange working by October 1st, we don't have enough time to get this in place. And two, when you look at what the purpose of the active negotiation is, it's to engage in negotiations for the reason, the purpose of reducing premiums. That's where I talked about the consumer reports. You don't go to buy a car with no information. Unless you want to pay full price, you pay the sticker price. Yeah, you can walk into any dealership today and pay sticker. But everybody knows that the real value of a car is something less than that. And the way that you drive the best bargain is by getting the most information before you sit down in that process. That's what the amendment does. Is it says, let's get that information. But it comes from those individuals who have said, that are governing this, have said there's not enough time to implement and we need more time to accumulate the data so that we're in a better position to negotiate in the future. So this is basically putting into effect what they have said they want. Through you, Madam President.
Senator Kane.
Thank you, Madam President. And if I may, if you could take me back just a little bit further. The exchange is created in response to the Affordable Care Act, correct? Through you, Madam President?
Senator Kelly.
Yes.
Senator Kane.
Thank you, Madam President. And Connecticut created the exchange in advance of that Affordable Care Act, but did not necessarily have to do so. Is that also correct, or am I wrong in that case, Madam President?
Senator Kelly.
Well, I believe Connecticut, I don't know if we did it before the Affordable Care Act, because I'm not sure we had the authority to do so, but we're clearly a leader in the implementation of the Affordable Care Act when compared to other states in the country. Through you, Madam President.
Senator Kane.
Thank you, Madam President. And that's what I was kind of getting at, and I agree with you on that. So this October 1st deadline that is in the bill and that you talk about, how will that be affected by your amendment? Meaning, I know you said that the exchange met and they said they're not going to have enough time. The October 1st deadline is something that is hard and fast, or is it something that really anticipates the implementation of the Affordable Care Act come January 1st of the following year, through you?
Yes, Senator Kelly.
Thank you, Madam President. The October 1st deadline is, as I understand it, a hard and fast date for the exchange to become operative. And the exchange, as you understand, is the marketplace where insurance products would be the marketplace for the insurance products. Through you, Madam President.
Senator Kane.
Thank you, Madam President. And in your comments earlier in regard to the amendment, you talked about the CEO of the exchange and his efforts in a couple of other states. I think you mentioned Massachusetts and California. These states that you speak of, are they setting up their exchange the same way we are in the underlying bill? Through you, Madam President.
Senator Kelly.
With regards to how other exchanges are structured, I haven't evaluated 17 other states. I do know that many proponents have pointed to Massachusetts as a state where savings have been achieved through active purchasing. But that active purchasing and that design is different than what we're doing. And it differs because in Massachusetts, the active purchasing component was only for those individuals who are participating with a subsidy versus everyone who enrolls in the exchange. So in that manner, you have individuals that are known to the exchange. You have the enrollees. They know the demographic. They have the utilization. So they had the information that I'm talking about, which is necessary in order to negotiate from a position of strength. And they achieved some savings. So if we want to do the same thing, it would stand to reason that we wouldn't want to deny our exchange that same opportunity. If we were limiting our exchange to just the subsidized individuals, then maybe there'd be more grounds for moving forward. But because we're going to be more broad-based and include everyone, well, we're including a population that we don't have the information on, and we need the time to take to get that information to put the exchange in a better position. Through you, Madam President.
Senator Kane.
Thank you, Madam President. I thank Senator Kelly for his answers, and that clarifies the amendment for me greatly, and I'll be in support of the amendment. Thank you.
Thank you. Will you remark? Will you mark? If not, Mr. Clerk, will you call for a roll call vote, and the machine will be open.
Immediate roll call has been ordered in the Senate. Senators, please return to the chamber. Immediate roll call on Senate D. Senators, please return to the chamber.
closed. If all members have voted, all members voted, the machine will be closed. Mr. Clerk, will you please call the tally?
Senate Amendment Schedule D for Senate Bill 596, total number voting 35, those voting yea 13, those voting nay 22, absent not voting 1.
Senate D fails. Will you remark further? Will you remark further? Senator Kelly.
Thank you, Madam President. Returning to the bill, one of the things that I think is at the center of this debate is competition. And not just any competition, but it's what is the competition and who is going to be responsible for that competition. Are we going to entrust an exchange in government, or do we trust individuals and families of Connecticut? So when we look at active purchasing, what that concept does is it looks to use the exchange's authority and market power to promote value for consumers. It believes that the consumers can't do that on their own, that some organization or entity needs to do it for them, and that active purchasers can use a range of tools under its administrative authority, from regulation, negotiation, consumer education, to oversee the insurance market to minimize any gaming by the insurers. That's basically what active purchasing does. The opposite is the open marketplace model, wherein the exchange becomes a clearinghouse where all qualified insurers meet minimum standards may participate. So it's not a totally deregulated market. You do have to meet minimum standards. There are protections built in. And so the question before us is, whom do we trust? Do we trust government and the exchange, or do we trust individuals and the marketplace? Now, very often here in this circle, we talk about Connecticut being the insurance capital of the world. We pride ourselves on our insurance industry. We claim that we have the best insurance companies in the world. We have the brightest insurance individuals in the world to go with those best companies. We believe that they are second to none, except when it comes to the exchange. Because this bill doesn't put any faith and credit in that industry. It doesn't believe that that industry can be innovative, creative, and provide Connecticut families with good, quality, affordable health care. That the only way to do that is through an exchange appointed who will negotiate on behalf of the consumers. We're going to create a layer of bureaucracy in order to accomplish that goal. And my question will be, how often has Connecticut gotten it right with creating bureaucracy at an effective and efficient manner? All I know is in 2010, when I ran, There were a number of reasons why I ran, but one of the first two were called Kevin and Catherine, my kids. Because our government spending at that time was out of control. We had a $3.5 billion deficit built largely on one-time expenditures and borrowing to pay current obligations. Guess what? 3 years later, we're doing the same thing. We have more government than we can afford, but we're telling the people of Connecticut that that's good for them. And I think this is the same type of program. It's the same concept. Our government is not efficient in this state. It costs too much. And everybody I talk to in the streets of Stratford or Shelton, Seymour or Monroe tell me that every time I go back. Nobody's saying, give me more inefficiency. Give me more tax. But when we look at this, what this bill is saying is, who's going to be more effective? And that's the choice we have to make. Are we going to choose an organization created by our government to oversee this opportunity of whether or not you can get affordable health care, or are we going to trust in ourselves? Utilizing an exchange that will still have requirements so that the consumer, like I was saying with the Consumer Reports in buying a car, will have an opportunity, much like when you go to Expedia or some other, that you'll be able to compare and contrast the different policies, but allow the marketplace to be the creator, the innovator, to provide better products at a lower cost. Keeping in mind also that one of the premises of the Affordable Care Act is also to have quality health care when you've got your insurance product. Because I'll tell you, it doesn't matter if I've got a great policy if there's no hospital to take my kids to when they are in need of those services. Or if I have to travel, instead of to Griffin Hospital, I have to go to Yale, New Haven, or somewhere else that's maybe 10 miles further away. So we got to keep this in mind as to what are we doing and why are we doing it. I've put up amendments that have talked about taking our time to give active purchasing a chance. But to let's not just rush in, but to get the necessary information, study the feasibility, and then if it comes back favorable, then we'll entertain that. But we don't want that study, despite the fact that we see study bills all the time over our desks, over a whole host of different reasons. I just have to pause for concern when people that we entrust to handle the governance of the exchange are telling us to take our time, and we choose to override that. I just think it's something that reasonable people who are being fair would say that that's the proper approach. That's the prudent way to go. But we're not. We're going to take the affirmative step to impose this because we know better. And once again, it comes down to that choice. Which way do you want to go? Do you want to go towards the choice of more bureaucracy or less? Simple as that. Madam President, the clerk has an amendment, LCO number 7413. Will the clerk please call the amendment?
Mr. Clerk.
LCO number 7413, Senate E, offered by Senator Kelly.
Senator Kelly.
Thank you, Madam President. This amendment basically will accomplish what I just said. It will opt for an open marketplace. It will put our faith and trust in the citizens of Connecticut and in the insurance industry, which we are so proud and often brag about. Will put its faith in that.
Senator Kelly, you move for adoption?
Pardon me, Madam
No
President.
problem.
I move adoption by roll call and seek leave to summarize.
You'll have a roll call and motions on adoption. Will you remark, sir?
Yes, thank you, Madam President,
Thank you.
for the correction to get us back on track. What the amendment does is basically what I've just been talking about, is it gives us that opportunity to choose, to pick the path, to pick whether it's going to be active purchasing or more of an open marketplace, meeting minimum standards, providing comparative and standardized information to consumers to allow them to understand not only the products they buy, but to get a lower cost through the innovation of the insurance industry. Who do we trust to do that? And I believe that this amendment will come down on the side of individuals and our insurance industry, which we all know is second to none. I would urge its adoption. Thank you very much, Madam President.
For your remark, Senator Crisco.
Thank you, Madam President. Madam President, I rise in opposition to the amendment. The amendment destroys the entire plan that's been in place, and I believe it would be a great detriment to the people of Connecticut. And I assume that Senator Kelly has asked for a roll call vote. If not,
Yes,
I
he
ask
did,
for it.
sir.
Thank you. Thank you, Madam
Will
President.
you remark? Will you remark? If not, Mr. Clerk, will you call for a roll call vote, and the machine will be open.
Immediate roll call has been ordered in the Senate. Senators, please return to the chamber. Immediate roll call on Senate E. In the Senate, senators, return to the chamber.
All members have voted. All members have voted. The machine will be closed. Mr. Clerk, will you please call the tally?
Senate Amendment Schedule E for Senate Bill 596. Total number voting 35. Those voting yea 14. Those voting nay 21. Absent, not voting 1.
The amendment fails. Will you remark further? Will you remark further? Senator Kelly.
Thank you, Madam President. Just in conclusion on the bill, I wanted to relay to the circle one individual who testified at the committee. And I just thought it was interesting, so I thought I would state it again. It was presented by James Sterling, who's the CEO of Sterling Benefits. And he was testifying in support of the bill. And this is what he said. There is no harm from passing Senate Bill 596. We may not need to negotiate with insurers this year, but pass the bill now so that this tool is available if needed in the future. Just having it on the books will likely make the Connecticut exchange more successful. Kind of sounds familiar to a Speaker of the House who said, we're going to have to pass the bill to find out what's in it. That proponent said, let's just pass this, because if we have it in the toolbox, maybe it'll be of some benefit. I think Connecticut residents deserve better. They're demanding better. And I think we can deliver better than what this bill does. Thank you, Madam President.
Thank you. Will you mark further on the bill? Will you mark further on the bill? If not, Mr.